1,196 days. That's how long Americans have lived under a public health emergency because of COVID-19. Well, tomorrow, that officially comes to an end, although it may feel like it returned to normal months ago.
As a person with a disability and with low pulmonary function, I'm vulnerable to COVID in significant ways. Even though the official emergency was ended, I can't end my disability. I can't end the vulnerability to the kinds of physical ailments that come along with COVID. More than half of the week I'm spending at home. But in many ways, COVID is ever present with me. So when I'm in a crowd of people who aren't masking, or when I'm on the bus and I see people who aren't masking, I'm scared. I think about my low lung capacity. It's at 20% of where it should be. And because of that, I'm at high risk for serious illness if I get sick. And that is the case for so many people with disabilities and with immunocompromised conditions.
When I heard that the COVID emergency was being lifted, I felt just kind of burnt out. In 2018, I suffered a very brief illness that led to me needing a liver transplant. I had to learn how to rewalk. I had to learn how to refunction. When COVID hit, it was just this whole other, like, what do I do? I'm super vulnerable, and I had this opportunity to live, and now all of a sudden I have to be that much more sheltered and that much more afraid. To this day, we still do not go to any large gatherings without wearing masks. Any time that I go inside, I wear a mask. I've traveled like 30 minutes to a store and realized I didn't have my mask. It's the same thing as not having your wallet. You know, I can't go into the store. I have to start over. The gym that I go to, not everybody masks there, but the reason I chose the gym is because they're small group classes and they're very accepting of everybody. I've never had anybody question me about the masks there. There's definitely some anxieties about being in work and about interacting with people, even though I'm protecting myself as much as I can. I've gotten a little bit of negative feedback. I have a few people occasionally just say, "What are you wearing a mask for?" You know, at first I would sometimes get upset, I would sometimes get defensive. At this point, I really don't care because I know that it's at least protecting myself, and that's all that I can really do.
When you do things like send this message, the pandemic state of emergency is now over. You know, the public hears, oh, well, the pandemic is over, I can go back to my normal activities. What we should be talking about is how many people are dying a day, who is still at risk. It's not just the immunocompromised that have to worry. Anybody could catch long COVID. Most healthcare institutions have ended masking requirements, and some medical institutions are making it really difficult for patients to request masks.
The Americans with Disabilities Act doesn't speak specifically to the issue of masking. What it says is that people with disabilities have a right to reasonable accommodations. And so a disabled patient has the right to ask that their provider and any other hospital staff that would come close enough to them to plausibly infect them be masked. And if a hospital turns down that request, it's going to have to show, potentially in court, that that accommodation request is unreasonable.
In my own personal experiences, it's harder in certain places to even find a mask. And a lot of my healthcare providers are not masking anymore. And it feels hard. It feels uncomfortable to ask people to mask. And I wish that it would be something that I wouldn't need to ask about. This is really a catch-22 because the more our disabilities are impacting our health, the more that we seek out care. And yet the more that we seek out care, the more likely it is that we're coming into contact with viruses or other sicknesses out there.
over and over again throughout the pandemic. We've had to elbow our way to the table and ask for changes to policies that have already been announced. It happened with the crisis standards of care. It happened with some of the vaccine rollout, where people with many kinds of disabilities didn't get prioritized when they should have been. And now it's happening with masking. We are being, in a real sense, sacrificed for the sake of other people's convenience. If decisions are being made about our community, we don't just need to have a seat at the table, we need to be at the head of the table, right? We are the experts on our own lives and our own needs, and our voices need to be respected in that.
As the numbers rise again, there's more concern. There's definitely tightening up the ship, if you will.
We're gonna just move the pizza over.
I'm nervous going into the fall school season. I have a young child who's going to be starting preschool, and there's concerns about what's going to happen in that setting.
Look over at the table.
Little kids spread illnesses all the time as they build their immunosystem, but with COVID rising, there's a huge concern that that could come back home again. I mean, little colds that my son has brought home have landed me in the ER for the weekend.
Happy birthday to you.
We don't want to cut our son off from any sort of social activity. But, we have to be cautious about what we're doing.
Okay.
If I get really terminally sick, or if I do test positive for COVID, what does that mean for my child? What does that mean for my partner? And what does that mean for me?
You're all done again. You're all done again.
I've already been really, really sick and on life support, and I don't want to I don't want to be there again. So a lot of people, I think, just don't understand what it's like to have that fear of getting sick and getting really sick, and I just wish that there was a little bit more courtesy. One person's inconvenience about wearing a mask is, I think, a small inconvenience for somebody potentially getting severely ill or worse.